Hi everyone, Dr. Eric here from Med Better Health, and I want to share something pretty deep and personal with you. It happened this morning, and I felt that I should share it with everybody. So as I'm driving to the office at around 7:30 in the morning, I get a call from one of our team members, a nurse practitioner. Dr. Eric, is it okay that I speak with you? I'm like, oh, okay, like 7:30 in the morning. Is it something really critical? What's going on? Dr. Eric, yesterday there was a situation where I was giving some advice and guidance regarding a medical situation to a family. And the family wanted to also get the advice of their physician. And the physician starts to speak with me. And the first thing that the physician says is, are you even a real doctor that I should be speaking with you and that you know what you're doing? Let that sink in for a second, right? There are two professionals that are having a conversation, a crucial conversation about someone. And then the physician says the starting point of that conversation is, are you even a real doctor? So let's unpack that for a second. The first thing that comes to my mind all the time is, what am I here for? What are we here for? We are here to help patients and caregivers, right? As professionals, as medical professionals, that is the one thing that we're here to do, to solve problems, to give advice, to make the life of a caregiver and a patient better. So when I'm speaking to another professional, imagine if the first thing I say is something offensive to offend them personally, right? What am I doing? I'm shifting the conversation now between us two from the key point at hand, which is what is best for the caregiver or the patient, to I just attacked someone's ego, someone's self-worth, and now that person is not going to be responsive to me on the key issue at hand, but they're going to respond on what? You just offended me. I'm not a good enough clinician. And that's going to be their mental frame. So what did you do right there? You automatically shifted the conversation. And that's not going to be what's best for the family or the caregiver. And in fact, there's a great book, an amazing book that I recommend all of you read, and it's called Crucial Conversations. It's a great, amazing book, and it defines what is a crucial conversation. Well, the crucial conversation has three things involved. Number one, the stakes are high. So you have very, very high stakes. Number two, the opinions vary. You and I don't agree. Stakes are high, patient's life. You and I have a difference of opinion. And number three, because of that, emotions start to run high and strong. That's a definition of a crucial conversation. The first step that you need to do is say, I'm having a crucial conversation, right? You got to step away from yourself and say, I'm about to get into a crucial conversation. Because if you don't see and you don't recognize it, so that physician who spoke to the nurse practitioner, that's the first thing they should have done. They should have stepped away and understood that they're getting emotional, right? That's the emotional intelligence part. The second part that they should have understood is that when I'm offending someone and saying, are you even a real doctor that I should be speaking with you, that this individual's emotions are also going to start to run high. And now they're going to be on attack mode, and you're going to forget the main issue. The third thing is, that's really irrelevant. You're both professionals. Is your ego speaking? Do you feel a little bit offended that, oh, there's a nurse practitioner or a physician assistant, right? In my experience, there have been amazing doctors and amazing nurse practitioners. Some nurse practitioners that we have in our team are just as good or is not better of a doctor. And are you feeling threatened by the fact that there's a nurse practitioner and you're going to speak to them that way? And in my mind, I'm like, well, if it's 7:30 in the morning, my team member felt the need to speak to me about it. It wasn't a legal thing. It wasn't, hey, Dr. Eric, can I pick your brain on clinical? It was, I just need to speak to somebody because I just got offended and I feel hurt. And I need someone to tell me that I'm not just a nurse practitioner. I'm not just this and this. I need someone to listen to me, to hear me out. And that's what I did. I listened to my team member and I told them, look, 100%, you're incredible. Don't even think about that. that was a little bit of weakness on that individual side to even start off the conversation. How should have the conversation went? Hey, how are you? Listen, I know that you were thinking about these certain recommendations, but I was thinking, I'm not sure if you know, but there's this and this and this, and this is the factor. What are your thoughts? Perhaps we can reevaluate the situation and go a different direction, right? Now, what am I doing? I'm engaging that individual to be able to share into the pool of the collective. The second I attack them, they're going to be afraid to share their information, their knowledge into the pool of the collective knowledge because they feel anything they say, they're going to get attacked, right? So they start being afraid. And a lot of us leaders, we have that tendency, myself included sometimes. You're like, all right, just get to the point. Enough, stop it. Blah. But then you're cutting off your circle of actually contributing. So that nurse practitioner now, she wasn't going to engage in any conversation. She's like, what do you mean? I'm not a real doctor. Do I have to be a doctor to give recommendations? I'm licensed and I'm allowed to do this. So I want to know your thoughts, right? A lot of folks who follow me are not just caregivers and people living with dementia, but they're professionals, they're clinical physicians, they're nurse practitioners, they're administrators. Is this something that you've had where people weren't able to have a crucial conversation and emotions run high when the stakes were high and you had difference of opinion? Let me know. I'm sure it's not just in one organization. And you know what I'd love to know from you is if you can comment below, how do you deal with this? How do you overcome these specific situations? What word of advice would you give to our audience by commenting below about this? And, a lot of the times we have crucial conversations. We're part of the guide model. The guide model is we were selected. We're so blessed. We were selected by CMS, by Medicare, to pilot this incredible dementia program. It's a program that doesn't just focus on the person living with dementia, but it actually focuses on the caregiver. It provides the caregiver. Imagine a world where the caregiver can take time off, go to the beach, go to have lunch, go to get their nails done, right? And Medicare would pay for someone to sit there with their loved one. Imagine if 24/7 at 10 o'clock at night, the caregiver is thinking about, oh my God, my mom is seeing a ghost, but it's not really a ghost. Who am I going to call? Who are you going to call? Back in the day, I used to watch a show. We used to say, who are you going to call? Ghostbusters, right? And that used to be a cool theme song. But no, they can call Med Better Health, right, at 10 p.m. And someone who's skilled will be able to walk them through what to do in that situation. And we have these crucial conversations. Are you able to remain a caregiver for your loved one? You feel guilty. And some of you listening, you may be taking some care of someone who is living with dementia, and you may be guilty. You may have this guilt feeling inside, like, oh, I don't know if I can continue to take care of them, but I can't think about an assisted living. I can't think about other arrangements. No. Right? And then that's bad to your health, and that's also bad for the person living with dementia because you don't have the resources to take care of them. We have those crucial conversations, and we help caregivers, and it's all covered by Medicare. And if you're interested in learning more about this program, this is what I want you to do. I want you to go to this website that you see over here. I want you to click on the QR code, right? It's either here or it's going to be here in one of the places. I want you to click on the link in the description below, and you can learn more about the program. Easy form to fill out. We contact you and we help you out. Remember, be very sensitive and have patience when you're having crucial conversations. I'll talk to you soon.